Good afternoon, everybody, and thank you for coming again. I want to thank Robert Jenrick, the Community Secretary, and of course Dr. Jenny Harries. Today we've come to the stage of our plan that I advertised at the outset when we first set out the plan of the UK government, when we now have to take special steps to protect the particularly vulnerable. And you remember that I said that the moment would come when we needed to shield those with serious conditions. There are probably about 1.5 million in all. And in a minute, Robert Jenrick will set out the plan in detail. But this shielding will do more than any other single measure that we are setting out to save life. And that is what we want to do. Also to reduce infection and to slow the spread of the disease. And I want to say just a couple of other things. We have to do more to make sure that the existing measures that we are taking are having the effect that we want. So it's crucial that people understand tomorrow that the schools are closed, and tomorrow you shouldn't send your child to school unless you've been identified as a key worker. And more generally, in view of the way people have responded over the last few days to the measures that we have set out, I want to say a bit more about how we interact outdoors. And of course, I do, people to be able to go to the parks and open spaces and to enjoy themselves. It's crucial for health, for mental and physical well-being. But please follow the advice and don't think that fresh air in itself automatically provides some immunity. You have to stay 2 meters apart. You have to follow the social distancing advice. And even if you think that you are personally invulnerable, there are plenty of people that you can infect and whose lives will then be put at risk. And I say this now on Sunday afternoon, Sunday evening. Take this advice seriously. Follow it, because it's absolutely crucial. And as I've said throughout this process, we will keep the implementation of these measures under constant review. And yes, of course, we will bring forward further measures if we think that is necessary. So always remember, in following this advice, and I know how difficult it is, but always remember that each and every one of us, you are doing your bit in following this advice. You're doing your bit to slow the spread of the disease, and the more we collectively slow the spread, the more time we give the NHS to prepare, the more lives we will save, the faster we will get through this. And always remember, we will get through this, and we will beat it, and we will beat it together. So next, Robert Jenrick to outline the shielding measures that we're going to be bringing forward in the next few days. And to save thousands of lives. And today we've come to the stage of our plan that I advertised at the outset when we first set out the plan.
Following the Chief Medical Officer's guidance, the NHS has identified up to 1.5 million people in England who face the highest risk of being hospitalised by the virus. The NHS will be contacting these people in the coming days, urging them to stay at home for a period of at least 12 weeks. I know that many people will want to know whether this applies to them. This will include people who are living with severe respiratory conditions, specific cancers, such as of the blood or bone marrow, those who've received organ transplants, and some, though not all, of those receiving certain types of immunosuppressant drug treatments. I know that many people watching at home will want to volunteer once this service is established. There will be opportunities, and everybody can contribute in different ways. In every city, in every town and village, there's a huge amount of work to be done, and each of us has the power to do it.